Greetings to all viewers. Quite often, bleeding in women is not just hormonal problems. On scan, you might find something called polyp or a submucous fibroid. Quite often, when the uterus is not grossly enlarged or there is no basic big pathology, patients want us to treat it with medicines. But when there are polyps or fibroids, it is not possible for medicines to control it. And therefore, you may require surgical procedures to remove it. A small surgical procedure which is well known to everybody is dilatation can cure attach, but it may not remove it. So this video is to talk about another procedure called hysteroscopic surgery. I am Dr. Shobhana Mohandas. I am a gynecologist and laparoscopic surgeon at Sun Medical Center. Quite often patients come with submucous fibroids or endometrial polyp. Polyps are growths like grapes hanging out from the uterus. They may be single or multiple. And you may ask, why don't you just put blindly some instrument and remove it just like that? Like in the earlier days when we could not think of hysteroscopy, this was tried quite often. The difference between a DNC and hysteroscopy is that in a DNC, you put your instrument blindly into the uterus and you are curating. You don't know whether the polyp will really come out or not. It may or may not come out. If you're lucky, it will come out. But if your instrument doesn't hit that polyp, it may not come out. So that is not the right way to correctly remove all of it. In hysteroscopy, you can see the whole thing on a screen. Everybody in the room can see it, and you can properly go and cut out the polyp using current with specific instruments, and it is a much better procedure to make sure that the whole procedure is complete. Now, another reason why we do hysteroscopy in bleeding is submucous fibroids. That is fibroids which push into the uterus. This is the uterine cavity, and you can see that the fibroid is pushing into the uterus. The fibroids which push out into the outside are not the ones which are for hysteroscopy, but the ones which push into the uterus cause a lot of bleeding. And here the patients say that, oh God, it's bleeding so much, you remove the uterus. And quite often this doctors also sometimes advise hysterectomy. But if the fibroid is the cause for bleeding and the fibroid is pushing into the uterus, a hysteroscopic fibroid removal may be the best option. When you remove fibroids through the uterus, it is a single day procedure. The patient comes home in the morning, goes home in the evening. She can do all duties. Unlike a hysterectomy which requires convalescence, hysteroscopic fibroid removal does not require any rest. She can join duty as soon as possible, and she saves a lot of time and effort. So this is just to, although the procedure is very long, before it was there. This is to introduce hysteroscopy to you. Hysteroscopy has been there for a long time, but it has not become very popular, and so I thought I would put this video to introduce this particular surgical modality to you. Thank you so much.